Welcome to Breast Intentions, the podcast where we take off the bra of expectations and dive into honest, empowering conversations. We're your hosts, Nadine and Cynthia, two Canadian girls who swapped snow boots for flip-flops in the Cayman Islands. This is your space to feel seen, supported, and a little less alone. So grab a cup of coffee or a glass of champagne and get ready for your weekly handful of truth, wellness, and empowerment.
I'm Nadine Dumas.
And I'm Cynthia Rowe.
And we are the hosts of the Breast Intentions podcast, a podcast where we cover everything for women from midlife, menopause, perimenopause, health, and wellness.
We decided to do the Executive Women's Health Check at Health City because it falls in line with what we talk about every week on the Breast Intentions podcast. We always talk about education and empowering women to get to know themselves a lot better. And with knowledge comes power and what we can do to help ourselves if needed.
I decided to do the Women's Executive Health Check mainly because there's so many women that I come in contact with on a daily basis and help them understand who they are. And I felt that it was something that was also important for myself so that I can share some information of my experience to also help encourage other people to do the same. From the moment that we walked in the door, we were greeted by the staff. We got brought to all of the different testing stations, and every single doctor that we met with gave us a description about what it was that we were going to be doing, what it was that they were looking for, and how long it would take for the results to come in.
Yeah, it did feel like when we first got there, we were almost given a nurse by our side the whole time, and she helped bring us to our appointments. And when we were done our appointments, either right away she was there waiting for us, or shortly after she came to bring us to our next appointment, which was nice because you kind of felt like you had somebody with you throughout the process. And like Nadine said, like everybody talked to us through everything that we were doing, whether it was the tests and what was expected, and let us ask questions if we had any that they didn't kind of cover, but they covered everything pretty much in depth. I thought it was pretty neat how, you are meeting with all of these different doctors and nurses along the way, and it felt very coordinated. For me, what stood out was after we completed all these tests, there's the app that you can go on to look at your results when they're available, which is pretty amazing. I've actually never had anything like that before. And also, we were emailed all of our test results shortly after, without asking for them, without any prompting. Like it's all just sent to my inbox.
I do think another thing that stood out for me was actually the food.
Oh yeah,
right, for the lunch.
Yeah, because that was included in it. We got to have our lunch, which it was.
I've never seen a hospital
that you wanted to go and eat
healthy
in the
healthy food, the green juices, the salads. Yeah, very, very well done.
So I don't think there was anything surprising about the results that I got. I felt it was kind of what I was expecting, but it's still reassurance. It's still good to see those results and know where you're at.
Right. I think what I found with the results, there wasn't anything surprising as well, but I think just the time that the doctor took to explain everything in detail, and actually took the time to sit down and answer any questions that I had.
If I were to summarize the whole experience, I would use the word empowerment. I feel very empowered and strong having all of this information about myself.
If I were to describe it, I would say it was very seamless. It was very well done. And it was a one-stop shop where everything could be done all together. So very, very well done for especially the busy businesswoman who does not have a lot of time on her hands to, and I think we talked about this as well, to jump to different doctors for different types of appointments. You can do everything
all in one. Yep.
After the health check experience, one piece of advice that I would give to a woman that's in midlife is to get it done. There's so much more information other than, I guess, maybe a woman just going in and getting her regular checkup with her gynecologist. This entails heart checks, stress testing, abdominal checks, mammograms, blood tests. So you can get everything done at once, and it's just a very easy way to answer a lot of questions for yourself, and maybe some things that you might not know as well.
If I were giving any advice to a woman in midlife about getting the executive health check, I would say just do it. You don't know unless you know. Welcome back to Breast Intentions. Today's episode is a little different and truly special. We were honored to be invited to Health City, Cayman Islands, to experience their brand new Executive Women's Health Check. From the moment we arrived to the moment we left, every step was seamless, thoughtful, and empowering. We're joined today by Rebekah Brooks, Head of Sales and Marketing at Health City, to talk about this exciting advancement in women's preventative health and why this offering is such a game changer, especially for women in midlife. Let's get into it.
So on today's episode, we have a bit of a different episode. We have Rebekah Brooks, the head of sales and marketing at Health City down here in the Cayman Islands. And we recently did the Executive Women's Health Check. And so we're bringing Rebekah on to dive a little bit more in depth to the Executive Health Check and maybe even some of the other health checks that you guys offer at Health City. So why don't you tell us a little bit more about the Women's Executive Health Check and what your thoughts are on it for women in midlife and how it works.
So Health City decided to design an executive health check. Well, actually several executive health checks. So we have like the cardiac executive health check, male executive health check, female executive health check, and then a basic one as well, which actually, to be honest, really isn't that basic. It is very comprehensive in itself. Really what we're trying to do is provide like a 360-degree approach to a wellness health check. So you may get a chance to go to your normal GP or doctor and have like a health check, or what they would potentially call a health check. And it's just a quick consultation, some blood work, your height, your weight, your blood pressure, a little chat, see how you're doing, maybe a bit of dietary advice. But this one actually provides literally a 360-degree view of your body. So we will do things like all the cancer screening markers. We'll do a mammogram, a pap smear, hormone panel, which obviously is particularly important for this midlife age group that we're just talking about today. You have a dietary consult, full-on comprehensive cardiac screening. So in terms of ECG, stress tests.
Your little stress test.
Yeah.
We did that.
Yeah, we did that. Really, and we're very conscious that people, particularly females, are busy. They're either taking care of somebody else or multiple people, or they're busy executives, and they don't take time for themselves. And I always sort of use the analogy that, when you're on an aeroplane, they always say, put the oxygen mask on yourself first. And that really should be for a lot of females, whether they're a mother or a high flying career lady. You can't take care of anybody else unless you look after yourself. Right. So it's really important.
And sometimes in midlife, it just kind of sneaks up on you and you're forced to kind of look after yourself.
Yeah.
And this is a way to kind of get out in front of it.
Get ahead of it,
And particularly from that sort of aspect of looking at hormones, we have female physicians that you'll be able to see and discuss and tell people how you really feel from a psychological standpoint. And then they can look into that a little bit deeper with specific hormone panels as well. Yeah.
The gynecologist, we had a really great experience with her. She was wonderful.
Yeah, she's lovely. Yeah. She's very special.
Why is the full body health screening so important? Why do you think that women aren't doing this regularly?
I think sort of they go for, say, like a quick 30-minute consult with a GP, and then you think, I need a mammogram. So then you'll get a script for a mammogram. And then, may not be the right time of the month to get a pap smear.
Right.
So you do that another time. But then all in eventuality, you actually don't go back to do those, you can't get around to getting your mammogram done, where we take people's time very seriously. So as, hopefully you experienced, it's very sort of a streamlined approach. We make sure that we literally hold your hand from step to step, take you from one place to the next, and you get everything done virtually in the morning as well, which is kind of unheard of in a lot of places. So
yeah. Oh yeah. I think that some of my friends back home that I told about it, that would never happen back home.
Yeah.
No.
Right. And like what we're used to is, you'll go for your physical, and then you'll have to come back for another test, or you have to go somewhere else to get blood work, or you have to go follow up with this. And so it is sort of like all these different days and all these different times and a lot of time out of your schedule.
Correct. Yeah.
And either it gets missed or you're just like, oh man, I have to do this on my lunch break. Or I have to do this I take some more time off work. But this was a way to just, get it all done.
And it's very sort of private as well. We have it in our beautiful new hospital at Cayman Islands, so really accessible. And we start very early as well in the morning. So if people want to go in at 7:30, so they're out by 11:30 midday. Right. We're really cognizant of that. And it's just a very nice, serene atmosphere, very calm. And
it really is.
Yeah. And you have great coffee.
The restaurant's amazing.
The restaurant has the green juices.
Yeah. So very healthy approach. So we get a lot of people coming just for our cafeteria, just they need to come to the hospital and they come for a curry or for something healthy too. Not that curry isn't healthy, obviously it is.
No, it was quiet and serene and comfortable and it did feel kind of Zen-ish. Yeah. For a hospital, like who you don't put those words together. Yeah. No. But it's a newer hospital and it is designed very nice. And I think with that in mind.
Very comfortable.
Yeah.
Yeah. And kind of going back to that as well, like just how impressed we were with like how efficient it was, how respectful everyone was, how seamless everything was. How does Health City ensure this kind of patient experience?
So we like to provide a great experience from a medical perspective, obviously really quality healthcare, but sort of from a customer experience as well. That's just as much paramount importance to us. So we have designated care coordinators that will schedule all the appointments ahead of time. So that's why it just flows from schedule to schedule and have a seamless approach as well. So we have a team that works very well together. Have two wonderful nurses. They really are amazing, that are very compassionate as well, that take you from step to step and make sure you're taken good care of. So it's a real sort of team approach. Obviously, there's quite a lot of coordination on the back end, but you don't see that. So and hopefully you don't feel it either because it just kind of flows well. So.
You don't, and you do, like I said earlier, it does feel like you kind of have that buddy with you. Yeah. Kind of meeting you between appointments and taking you around, which is comforting. And it is nice to have that.
Yeah. So for many women, just kind of looking at the women's executive health check, there's a lot of women that juggle careers, juggle family. What message do you think that Health City sends by offering something like this?
I think it's really to empower women, to make them feel that they are very, very important, obviously. And, they're the ones that always take care of everybody else. And so it's just to have their own designated appointments that really, are age appropriate as well. So even, we can do bone density, mammograms, pops, depending on your age and what you require. That's how we sort of complete the whole health check. And I think to have that personal approach is really key. And hopefully ladies feel very special by it, really.
Yeah, definitely.
Well, and I think with the podcast, that's what our aim is as well, is to empower women. So to be able to partner with you guys and get the executive health check done, there's so much that is in line with what we believe in and what we're trying to help women. A lot of it was like silencing out a lot of the noise and giving women this opportunity to learn more about themselves, where that doesn't happen very often. Yep. And that is what we're very big on, is helping women find a place so that they can learn about themselves and not be so confused by so much other information that is out there, especially social media and the industry, and being fed different things of how you should feel or what you need. Yeah. This is a one shop where everything is covered and everything is important.
Yeah. And, going back to your interview that I had earlier, all your results are available. We have an app that you can look at them yourself. So if sometimes you come away from appointments, or at least I do, and I think, I never forgot to ask that. You know what I mean? Or what was that? I wondered. And because you want to, look at it in yourself and read all about it if you want more information on it. So I think having that accessibility to your medical records is key too, to help you feel that little bit better at making decisions about other things you want to do. So
definitely. And very rare, I find. Like, it's not that you can't get your medical records. Obviously, you have the right to request those from anywhere. But it is a process. Sometimes you have to, put it in writing, or you have to ask this person or this person. And this was just
Yeah,
given
and
right
that's
to
one
us.
of the things that we try at Health City is to take all of that hassle factor out of everything. So as much as possible, we try, with the appointment scheduling, with having access to your medical records and having someone taking you around. It's all just trying to remove those things that are real pain points. And we've tried as much as possible to get feedback. So everybody that has a health check, we ask for feedback, positive or negative, because if we don't hear the negative things, then we can't improve. And so, we always take everything into consideration afterwards. So.
Right. Other people or other women that have experienced this program, do you have any stories or any feedback, I guess, what we were just talking about?
Yeah. I mean, most people will say, gosh, it was so fast. I thought, I took the whole day off work.
Yeah.
And actually some employers, which we go around to a lot of corporations and sort of discuss the importance of them having these health checks.
Great.
And so the companies, actually, I can probably give a shout out to DART because they give each employee a whole day off. So they love coming to us because they're like, we're done in 2 or 3 hours and then we can go.
And then they get the day off.
So, they love that sort of convenience factor. Some people have said they feel very empowered, by having everything done all together. They can really sort of make decisions and feel better about themselves. Like you say, you're not thinking, gosh, if something is wrong, but I don't go and ask about it, or I don't,
right?
You know what I mean? Yeah.
You think although I think I'm healthy, I think I'm fine, but you never know unless you have the test done, especially I think when it comes to the heart. We had a holistic cardiologist on, Dr. Mona Shaw from Florida, and she was telling us that heart disease, heart attacks are the number one cause of death for women, which is scary.
Yeah.
And also with the heart, you can think you're fine and you're not. And you don't know until, So doing things like the stress test and the EKG, I got those right?
Yeah.
Is important. Yeah. And so it's like a weight lifted off kind of.
Yeah.
And you can find out really pretty easily if there's something you need to be worried about.
Yeah. Definitely, prevention's better than cure. And we've all been trying to sort of hamper that home for years, actually.
Yeah.
But actually, I think just making it easy and accessible and able to do it very quickly and all in a one-stop shop.
Yeah.
People are more likely to do those tests if they know that they're already organized for them. So, yeah.
Do you have international
we
people
do.
come?
So I have an international team as part of my team, basically. So we have representatives in Latin America, in Eastern Caribbean, Western Caribbean, Canada, the US, and Latin America. We have a lot of people. I think I've said Latin America, so apologize if I repeated myself then, but we have a lot of people that come from different jurisdictions just for an executive health check. And we actually found someone that had quite a serious cardiac condition coming from another island.
Really?
And then obviously subsequently had the testing and procedure done after that. So we do get them coming. And even if they're coming just for a vacation as well, that we have, or another angle that we've had is that some of the corporations here, say like some of the banks or the law firms, also have offices in different jurisdictions that perhaps the healthcare isn't as robust as what we have. So they get their executives to get the health checks done when they come to visit Cayman, if they're coming for some other office procedures as well. So we do get a lot of international patients. And if anyone's interested on the podcast, we have a full concierge team as well. So not only do we look after you in the hospital, but we also can pick people up from the airport and take them to the appointment. And we have accommodation on site as well at the hospital at East End, but we provide transportation from East End or to Grand Cayman.
Oh, that's amazing.
Is that part of what it is that you do? You're part of your job?
Correct, yes. Yeah.
The international side.
Yeah. So probably about 30% of our patients are international patients. So.
Really?
Oh,
okay.
Yeah, that's
Didn't
fine.
know that.
Yeah.
That's cool.
For women who are listening and might be kind of nervous or unsure if it's worth it, what would you say to encourage them to make this
definitely worth it? Is it a really good price point? If we actually totaled it up, and I think we did once, it was about $2,500-3,000 worth of testing.
Right.
Yeah.
We had actually noticed that.
I think. Yeah.
We had discussed this that day. We thought, wow, if we did this individually, it would cost a lot more than
and your time. How much
your time. Yeah,
exactly. If you've got a high functioning job as well, that each hour you're out is costing money as well.
Exactly.
Exactly. Yeah.
Another question I have actually is, And I don't know if you've seen the stats on it. I'm guessing you probably have. Do you find more women or more men coming in to do the executive health checks?
Believe it or not, it's actually probably about 50-50.
Is it?
About 45-65, I think, yeah. And interestingly, I always thought it'd be the other way around. I thought perhaps more women, because women tend to make more of the healthcare decisions. But I think because it's so easy that the guys, again, it's that one-stop shop and they just go once a year, I'm in, done. And so many of my husband's friends will, go and get it done and say, it's great. I was in and out back in the office and before you know it. So I think that it appeals for not just males, but females in a big way. We also do specials throughout the year as well. So that's something for people to look out for. Okay. So usually around our anniversary. So we just had like one for our 11-year anniversary. And then we also do them around Mother's Day for the mum. So we had the female checkup and also around Father's Day as well. So really try and make it affordable for everybody. And even if somebody can't afford to have like the women's health check, they could still just have what we call, it's not really a basic, it's a comprehensive health check. And that still includes all your blood works, all your dietary assessments, a physician appointment, that kind of stuff as well. So still a good thing to have.
Okay, good. What's next for Health City in terms of women's health and preventative care initiatives?
So we're really sort of focusing a lot on women's health at the moment. So we look at it from all different aspects. We have obviously have our gynecological team that are also obstetricians as well. So we're focusing and our pediatricians too. So now we're trying to really sort of focus from babies upwards to try and cover everybody's angle. So, if you've got a teenager that's perhaps just started her periods or wanting to find out a little bit more, get a health check, we can look after her. Then we can look after the young lady that's hoping to get pregnant or just for a routine PAPS. And then, of course, the menopausal age group, the midlife, we're definitely focused very much on that. And we've been doing, a few health talks with different corporations as well, just in regards to that too. So, trying to sort of cover the whole time span. Female.
Which is great. Yeah.
Is there any other testing that you guys are going to be adding? Like, is there really any more that you could do?
Yeah, wellness is definitely obviously a huge part of today's society. There's a wellness centre that's going up directly behind our new hospital at Cayman Bay. We will be having some space in there and really sort of focusing on wellness in that. So in
wellness as in?
More sort of testing, I think, more so, and making sure that holistic care is taken care of. So yeah. Still in its very early stages, but I know it's the building's going up. So I think in another 18 months onwards. Yeah.
I didn't see it.
Yeah, you can see the construction has started. Yeah. How can women prepare for this type of visit, physically, mentally, emotionally?
I think sort of mentally, just sort of prepare by saying, I'm doing something good. I'm taking a proactive approach. Just as you were saying in your interview, it's more of a worry to have breast cancer than it actually is worrying about it, sort of thing. Yeah. I probably got that phrase sort of mixed up, but you know what I'm trying to say, that it's, unless you can't help yourself or make yourself better. So the fact you're taking that first step, I think, is a great move. And then you can cross the next bridges if there's anything to cross if and when you get to it. You just more than likely will come away with a clean bill of health and be good to go and get on with your busy lifestyle. So
so for, I guess, international listeners in the Cayman Islands, how would they go about scheduling an executive health?
Okay, so for local patients, actually, we have obviously the call centre number, which is 345-640-4040. You can also go on our website as well, healthcity.ky. And then, of course, you can download the app too, which is HCCI Connect, if you see that in your app store. For international patients, the app's not applicable for you yet.
I know. I tried to look at my test
when you're away and you're like, however, that will soon come, as they say here. But we also like with the international patients to make sure our concierge team takes good care of everybody coming from overseas as well. So we want to make sure that all the components are taken care of. So we advise you to, you can email international.referrals@healthcity.ky, and one of our representatives will pick that up and take care of you. So,
Perfect. If someone is wanting to come over internationally, how much time do they need? Like, how long would it take for them to get booked in?
So we can usually book probably within about 4 to 5 days of the sort of required appointment time,
which is
at the moment.
That's Fast.
And that's also ensures that we've got everything all streamlined and prepared for when you come. And then, of course, you can just literally come in and out in a day and have it done. But obviously, if you're traveling and it starts early, you're best coming in the night before. Maybe go out for dinner, enjoy the island a little bit more, and then fly back out. Yeah.
Okay. Yeah, that's fast. Especially we're both Canadian, so we kind of know how the healthcare system is in Canada, and there's virtually no way you could get appointments that quick.
How long does it take to get a mammogram back home?
Well, you have to meet certain criteria first to even get a referral, and then you're probably waiting months and months and months and months and months for your appointment. So where can people learn more about Health City and all of the health checks that Health City offers?
Yeah, so we have a website, healthcity.ky. We also have lots of social media, so we're in Instagram, Facebook, LinkedIn. We're always posting. That's part of my little baby too. So so there's lots of information out there. And of course, if you want to give us a call, you can write to our information line, or you can send a message to the call center, and one of us will pick it up and be happy to help.
Great.
Sounds good. Thanks for joining us on Breast Intentions. We hope you felt seen, supported, and maybe had a few laughs along the way. Don't forget to share, subscribe, rate, and review us. Your support keeps the conversation alive. Follow us on social media for more insights, behind-the-scenes fun, and updates on future episodes. Got a topic you want us to dive into? We'd love to hear from you. Remember, life's too short for bad bras, toxic relationships, and kale you don't actually like. So until next time, stay bold and keep your breast intentions exactly where they belong, front and center. Now go crush midlife, or at least today's to-do list. Cheers!